Welcome to our exploration of data interoperability in healthcare systems. In today's digital age, the ability for different healthcare platforms to communicate and exchange information seamlessly is more important than ever. Interoperability ensures that patient data can flow smoothly between hospitals, clinics, and other care providers, leading to better, more coordinated care. In this video, we'll break down what interoperability means, why it matters, and how it's transforming the healthcare landscape. Let's start by understanding the basics of interoperability and its role in modern healthcare. Data interoperability refers to the ability of different information systems, devices, and applications to access, exchange, integrate, and cooperatively use data in a coordinated manner. In healthcare, this means that electronic health records, lab results, and other patient information can be shared across different platforms without barriers. This seamless exchange is crucial for timely and accurate patient care, reducing errors and improving outcomes. As we move forward, we'll see how interoperability is more than just a technical challenge, it's a foundation for better healthcare. Imagine a patient visiting multiple healthcare providers. Without interoperability, each provider might have incomplete or outdated information, leading to repeated tests or even dangerous mistakes. With interoperable systems, all providers can access the same up-to-date records, ensuring safer and more efficient care. This not only benefits patients but also reduces costs and administrative burdens for healthcare organizations. Interoperability is truly at the heart of a connected, patient-centered healthcare system. Interoperability in healthcare isn't just one thing, it happens at several levels. There's foundational interoperability, which allows basic data exchange, structural interoperability, which ensures data is organized and formatted consistently, and semantic interoperability, which enables systems to interpret and use the data meaningfully. Each level builds on the previous one, creating a robust framework for sharing information. Understanding these levels helps us appreciate the complexity and importance of true interoperability. Foundational interoperability is the most basic level. It allows one system to send and receive data from another, but doesn't require the receiving system to interpret the information. For example, a hospital might send a PDF of a patient's chart to another clinic. The data moves, but it's not yet integrated or usable in a meaningful way. This level is a starting point, but more advanced interoperability is needed for true data-driven care. Structural interoperability takes things a step further. Here, data is exchanged in standardized formats, so receiving systems can organize and display it consistently. Think of it like sending a spreadsheet instead of a picture of a chart. The structure allows the data to be sorted, searched, and used more effectively. This level is essential for integrating information from multiple sources and making it accessible to healthcare professionals. Semantic interoperability is the highest level. It means that systems not only exchange data, but also understand and use it in meaningful ways. For example, a medication list sent from one system can be automatically recognized and updated in another, with all the clinical meanings intact. This level enables advanced analytics, decision support, and truly coordinated care. Achieving semantic interoperability is a major goal for healthcare. To achieve interoperability, healthcare relies on data standards. These standards define how information is formatted, coded, and exchanged. Some of the most important include HL7, FHIR, DICOM, and LOINC. Each plays a unique role in making sure data can move smoothly between different systems. By following these standards, healthcare organizations can ensure that their data is both shareable and understandable. HL7, or Health Level 7, is one of the oldest and most widely used standards for healthcare messaging. It defines how information like lab results, admissions, and discharge summaries are packaged and transmitted between systems. HL7 helps ensure that different platforms can communicate, even if they were built by different vendors. It's a foundational piece of the interoperability puzzle. FHIR, or Fast Healthcare Interoperability Resources, is a newer standard designed for today's digital world. It uses modern web technologies to make data exchange faster and more flexible. FHIR supports everything from mobile apps to cloud-based health platforms, making it easier for developers to build interoperable solutions. Its flexibility is helping drive innovation in healthcare IT. DICOM, or Digital Imaging and Communications in Medicine, is the standard for sharing medical images like X-rays and MRIs. It ensures that images and related information can be viewed and used across different imaging systems. DICOM is essential for radiology, cardiology, and other specialties that rely on medical imaging. Without it, sharing images between providers would be much more difficult. LOINC, or Logical Observation Identifiers Names and Codes, is used to standardize lab and clinical observations. It makes sure that test results and measurements are coded in a way that all systems can understand. This is crucial for sharing lab data between hospitals, clinics, and public health agencies. LOINC helps ensure that lab results are accurate, consistent, and ready for use in patient care. Interoperability isn't just a technical achievement, it has real benefits for patients. With seamless data sharing, patients don't have to repeat their medical history at every visit. Their care is safer, faster, and more personalized. Interoperability also supports telemedicine and remote care, making healthcare more accessible for everyone. Ultimately, it empowers patients to take a more active role in their health. Healthcare providers also gain from interoperability. With access to complete patient records, doctors and nurses can make better decisions and avoid unnecessary tests. Interoperability reduces paperwork, streamlines workflows, and allows providers to focus more on patient care. It also supports collaboration among care teams, leading to more coordinated and effective treatment. At the organizational level, interoperability leads to greater efficiency and cost savings. Hospitals and health systems can reduce duplication of services, minimize errors, and improve resource allocation. Interoperability also supports data-driven decision-making, helping organizations identify trends and improve quality of care. It's a win-win for both providers and patients. Despite its benefits, achieving true interoperability isn't easy. Healthcare systems often use different technologies, data formats, and coding systems. Privacy and security concerns add another layer of complexity. Overcoming these challenges requires collaboration, investment, and a commitment to common standards. In the next scenes, we'll explore some of the main barriers to interoperability. One of the biggest challenges is technical incompatibility. Many healthcare organizations use legacy systems that weren't designed to share data. Integrating these older platforms with modern solutions can be complex and costly. Upgrading technology and adopting common standards are essential steps toward overcoming these barriers. Protecting patient privacy is a top priority in healthcare. Interoperability must balance the need for data sharing with strict privacy and security requirements. This means using encryption, access controls, and audit trails to safeguard sensitive information. Healthcare organizations must comply with regulations like HIPAA while enabling secure data exchange. Change can be difficult, especially in large organizations. Some healthcare providers may resist adopting new systems or sharing data due to concerns about cost, workflow disruption, or competitive advantage. Overcoming this resistance requires strong leadership, clear communication, and demonstrating the value of interoperability for both staff and patients. Healthcare data is subject to strict legal and regulatory requirements. Laws like HIPAA in the United States set rules for how patient information can be shared and protected. Navigating these regulations can be complex, especially for organizations operating in multiple regions. Legal clarity and compliance are essential for successful interoperability. Application programming interfaces, or APIs, are key technology for interoperability. APIs allow different software systems to communicate and share data efficiently. In healthcare, APIs are used to connect electronic health records, mobile apps, and other digital tools. They make it easier to build flexible, scalable solutions that support data exchange. Let's look at a practical example. When a patient uses a health app to view their medical records, APIs are working behind the scenes to pull data from different sources and present it in one place. This seamless experience is only possible because of interoperable APIs, which translate and transfer information quickly and securely. Cloud computing is transforming healthcare interoperability. By storing data in the cloud, organizations can share information more easily and scale their systems as needed. Cloud platforms also support advanced analytics and machine learning, opening new possibilities for patient care and research. Security and compliance remain top priorities in cloud environments. Mobile health apps are becoming increasingly popular. These apps rely on interoperability to pull data from electronic health records, wearable devices, and other sources. By integrating data from multiple platforms, mobile apps can provide personalized insights and support better health management for users. Wearable devices and the Internet of Things (IoT) are generating huge amounts of health data. Interoperability allows this data to be integrated with electronic health records and used for real-time monitoring, early intervention, and personalized care. As wearables become more common, interoperability will be key to unlocking their full potential. Telemedicine relies on interoperability to connect patients and providers across distances. By sharing data in real time, telemedicine platforms can support virtual visits, remote monitoring, and follow-up care. This makes healthcare more accessible, especially for people in rural or underserved areas. Interoperability enables healthcare organizations to analyze data from large populations. By aggregating information from multiple sources, providers can identify trends, track outcomes, and design targeted interventions. This approach supports preventive care and helps improve the health of entire communities. Researchers benefit from interoperability by gaining access to larger, more diverse datasets. This accelerates medical research, supports clinical trials, and drives innovation in treatments and therapies. Interoperability also enables collaboration between institutions, leading to faster discoveries and better outcomes. During public health emergencies, interoperability is critical for sharing information quickly and accurately. Health agencies can track outbreaks, monitor resources, and coordinate responses more effectively. Interoperable systems help ensure that the right information reaches the right people at the right time. Healthcare is a global concern, and interoperability supports international data exchange. By adopting common standards, countries can share research, track diseases, and collaborate on global health initiatives. This is especially important for addressing pandemics and other cross-border health challenges. Interoperability empowers patients by giving them access to their own health information. With patient portals and mobile apps, individuals can view test results, manage appointments, and communicate with providers. This transparency supports patient engagement and helps people make informed decisions about their care. Effective data governance is essential for interoperability. This means establishing policies and procedures for managing data quality, privacy, and security. Good stewardship ensures that data is accurate, reliable, and used responsibly. Healthcare organizations must invest in governance frameworks to support safe and effective data sharing. Governments play a key role in promoting interoperability. Through regulations, incentives, and funding, they can encourage healthcare organizations to adopt common standards and invest in interoperable systems. Public policy is a powerful tool for driving progress and ensuring that all patients benefit from improved data sharing. No single organization can achieve interoperability alone. Collaboration between healthcare providers, technology vendors, and standards organizations is essential. By working together, stakeholders can develop solutions that meet the needs of all users and ensure that systems are truly interoperable. Looking ahead, the future of healthcare interoperability is bright. Advances in artificial intelligence, machine learning, and blockchain are opening new possibilities for secure, efficient data exchange. As technology evolves, interoperability will become even more central to delivering high-quality, patient-centered care. Artificial intelligence can help bridge gaps between different healthcare systems. AI algorithms can translate data formats, identify patterns, and support clinical decision-making. By automating complex tasks, AI makes interoperability more achievable and valuable for both providers and patients. Blockchain technology offers a new way to secure healthcare data. By creating a decentralized, tamper-proof record of transactions, blockchain can enhance trust and transparency in data exchange. This technology is still emerging, but it holds great promise for the future of interoperability. Machine learning algorithms can help integrate data from diverse sources. By analyzing patterns and relationships, these tools can map and merge information, making it more useful for providers and researchers. Machine learning is a powerful ally in the quest for seamless interoperability. The ultimate goal of interoperability is to put patients at the center of care. By ensuring that information flows freely and securely, healthcare systems can deliver more personalized, effective treatment. Patient-centered interoperability means that every decision is informed by the best available data. Across the world, healthcare organizations are achieving success with interoperability. From large hospital networks to small clinics, data sharing is improving outcomes and efficiency. These real-world examples show that interoperability is not just a vision, it's a reality that's making a difference today. Implementing interoperability isn't always easy, but organizations are learning valuable lessons along the way. Success requires clear goals, strong leadership, and ongoing collaboration. By sharing best practices and learning from challenges, the healthcare industry can continue to move forward. The journey toward full interoperability is ongoing. As technology evolves and standards mature, healthcare organizations must stay committed to the goal of seamless data exchange. By investing in people, processes, and technology, the industry can build a more connected, efficient, and patient-centered future. Everyone has a role to play in supporting interoperability. Whether you're a healthcare professional, IT specialist, or patient, advocating for data sharing and supporting best practices can make a difference. By working together, we can create a healthcare system that works better for everyone. Summary: data interoperability is transforming healthcare by enabling seamless, secure information exchange. It benefits patients, providers, and organizations alike, but also presents technical, organizational, and regulatory challenges. By embracing standards, investing in technology, and fostering collaboration, the healthcare industry can unlock the full potential of interoperability. Thank you for joining us on this journey through data interoperability in healthcare systems. As we look to the future, continued innovation and collaboration will be key to building a more connected, efficient, and patient-centered healthcare system. Stay informed, stay engaged, and together we can make a difference in the world of healthcare.